So COVID is around. COVID is still with us, and we still have lots of work to do. I mean, right? So first of all, if you take a step back, no question about it, we're in a much better place than where we were a year and a half ago when the president took office. Better than where we were a year ago. But we still have 300 to 400 Americans dying every day, still have tens of thousands of people getting infected every day. It's still quite disruptive. And so there is a lot of work to do to get this virus truly under control and to put it behind us.
And beyond that, you also have what some are naming a twindemic, or if you include RSV, three pandemics essentially, or three concerning outbreaks at the same time. How are you coalescing around that in terms of whether or not you might advise for a return to certain stricter mitigation measures? Is that on the table for this winter?
Yeah, so again, if you take that step back and think back to the fall and winter of 2020, right? We didn't have vaccines, we didn't have treatments, we barely had enough tests around. At that point, masking, social distancing, shutting down large gatherings, that all made a lot more sense. I just don't think that's where we are as a country anymore. Right now, we do have widespread availability of these brand new bivalent vaccines that are free, widely available. Pretty much everybody's eligible for it. We have treatments. We have lots of testing capability. In that context, yes, I mean, obviously, we're looking at the flu. We're looking at and worried about we might see with COVID or RSV. But I don't think we're going to need to do anything that resembles what we had to do in previous winters. I really do think we're in a very, very different place.
Well, Dr. Jha, some would disagree with you, saying that even though you do keep saying we have the tools, they may not be accessible or reachable for everyone, right? There might be price barriers. Some people might have to budget whether or not they can buy so many tests. And the time that it takes to get the COVID shots, we've already seen such a low uptake on these boosters. Are you concerned about that and about the messaging versus the reality?
Yeah, so let's talk about that reality. It's a really good question, Anjali. So first of all, vaccines are free, treatments are free. Tests are free for people who have any kind of insurance. If you have Medicare, Medicaid, private insurance. By the way, that's about 90% of Americans can go get up to 8 tests a month per member of the household for free. So just from a financial barrier, they are not substantial. Now, let me be very clear. There's still other challenges. These things are widely available, vaccines in 70,000 spots. Basically, almost everybody lives within 5 miles of a place where you can get a vaccine or a treatment. So then the question is, what are the barriers? For some people, it's still hard to take time off. We've been working with employers, encouraging them to take time off. For other people, if you're a single mom with three, doing 2 or 3 jobs, it's going to be difficult. So we've done a lot of work to try to make childcare more accessible. There are still those challenges, but I do think for a vast majority of Americans, access and financial barriers are not what's slowing people down.